whether you're a foreign national, you're not from here, fact is you're human, you need that health care for you to live.
So these people, they've caused depreciation in our budget. The health system, the budget is overflowing because of them.
I think it's disgusting to turn anyone away from healthcare that they require.
This exposes a lot of work that needs to be done from government. I think there has to be some involvement from Home Affairs. I think they need to get their ducks in a row.
7 p.m. Sunday night. We've got lots to talk about, my brothers and sisters. Let's get to it. It's Topical starts right now. A very good evening to you, South Africa, those watching around the world. My name is Blaine Herman, and this is It's Topical. Our digital audience tonight, they will weigh in terms of some of the burning questions they have for our guests in a short while. Good to see them. But we have to start here. It's been a day of explosive allegations relating to the criminal justice system. According to the briefing notes of the KwaZulu-Natal Police Commissioner, Lieutenant General Nhlanhla Mkhwanazi, an investigation has unmasked a syndicate which involves politicians, law enforcement, prosecutors, judiciary, and controlled by a drug cartel, as well as business people. Those are the serious allegations. The latest we're learning this hour, the African National Congress has released a statement noting with grave concern the allegations raised by Mkhwanazi. They say these matters go to the core of public confidence in the rule of law and the integrity of our institutions, and that the ANC is assured that President Cyril Ramaphosa is attending to this matter with the urgency and seriousness it deserves. So, to what extent do these allegations undermine the South African criminal justice system? Can such information be turned into evidence that will be admissible in court? The next few days, it's going to be interesting, right? Understatement. We shall be watching it closely, the possible repercussions stemming from this briefing. Also, on our watch, who is entitled to access the health care in South Africa? It's a topical question. What does the supreme law of the Republic say? The Constitution, Section 27, it guarantees everyone the right to access healthcare services, including reproductive healthcare. It also mandates that no one be refused emergency medical treatment, going on to say that the state is obligated to take reasonable legislative and other measures within its available resources to progressively realize this right. Now, we had reporting this week of alleged illegal migrants being turned away from getting medical treatment from public health facilities in Johannesburg and Durban. What rights do undocumented foreign nationals have regarding access to the South African healthcare system? Are laws and policies clashing? We will discuss. We want to get a better understanding tonight of the realities on the ground and how that marries with the laws of this land. Once again, the mandate of this show, we want to make conversation part of the cure. Let's get to our question of the week. We're asking you, what principles should guide healthcare access in a diverse society like South Africa? We want to hear your thoughts on this at SABC News_TV. Let's walk and talk. Get you some context as always. We need to talk about the financial integrity of our public health resources. Is it being managed in a fair and equitable way? Right? What is the best way, the right way of handling this situation? We're going to get you some perspectives. Coming up. All right, let's tee up the discussion for you. Faatima Laher joins me now live via our virtual platform. She's the legal researcher at Section 27. Faatima, good to have you on the program. Welcome.
Good evening to you and your viewers. Thank you so much for having me.
All right, I want to talk, first of all, Faatima, strictly in terms of what the law says. The constitutional provision regarding healthcare. Does it mean that all people in South Africa, regardless of nationality and legal status, does that imply?
Definitely. So our constitution, the highest law in our country, is very, very clear. And it clearly states that everyone has the right to equality, dignity, basic education, and especially healthcare services. It does not state that you have to be a citizen to access any of these rights, but it is broad and says that everyone is entitled to access, especially healthcare services in South Africa.
Now, some are arguing that it might be too broad. That's the argument being put forward. Does the Constitution qualify or limit this right in any way?
No, the Constitution doesn't limit this right in any way. It clearly states that everyone has the right to access healthcare services. Going back to 2022, as Section 27, we litigated on a department circular that barred migrant persons from accessing healthcare services. This case was brought against the Gauteng Department of Health and what this case was brought about was on the basis that all persons, irrespective of your nationality, especially if you are pregnant, lactating, or if you are a child under the age of 6, that you be granted access to healthcare services. And the court agreed with us. Deputy Judge President Sutherland, in his court order, clearly stated that that everyone has access to healthcare services, but people who are pregnant, lactating, or a child under the age of 6, they will be allowed access to free healthcare services. And this, the DJP Sutherland went on further to state that not just is this a right, but he ensured that this right is monitored, and it was monitored by asking the Gauteng Department of Health to put up circulars across public hospitals to make sure that people know their rights.
Right. Faatima, I just want to get the viewers an understanding of the obligations that South Africa has under both domestic and international human rights laws.
Hello, host. Are we allowed to talk over Faatima?
Sorry,
because
I think
Faatima has been saying stuff about the Constitution, which we obviously some of us are adhering to, but then, you know, the Constitution doesn't say anything.
Just give me 1 second, sir. I can't see you on my screen, so I'm not sure who's talking. We will get to the discussions in a short while. We'll bring you in a short while. So just give us a second on that. Faatima, go ahead with regards to South Africa's obligations under domestic and international human rights laws.
Definitely. So in domestic, we clearly know that the Constitution, the highest law of the land, states that everyone has the right to access healthcare services. The National Health Act also clearly states under Section 5 that any healthcare provider, worker, establishment may not refuse a person emergency medical treatment.
Right.
It does not define nor limit emergency medical treatment to any category of persons. Furthermore, Section 3(1)(d) of the National Health Act goes on to state, and it obliges the Minister of Health to ensure the provision of such essential health services, which must at least include primary health services to the population of the Republic.
Right.
Section 4(3)(b) goes on further and obliges the state and clinics, as well as community health centers, to provide free primary health care to all persons, of course, except to persons with medical aid schemes. Our international law is also quite clear. In just briefly, if we look at, for example, the Convention on the Rights to the Child, and in Article 24, this is international law which South Africa is a signatory to, clearly states that Article 24 compels states to strive to ensure that no person is deprived of his or her right of access to healthcare services.
Right. I'm not sure who's talking.
It's Freeman again. You know, it's Freeman again, Mr. Host.
Just 1 second, sir. We will get to the part. We just want to discuss for now the legalities and what the law says. We're going to get into the debate very, very shortly. I'll definitely give you a chance in that regard. Just one quick, before we wrap up this section, Faatima, I want to look at the pathways to enhancing healthcare equity, especially, and access to in South Africa, as referenced here by Sonke Gender Justice. When developing health responses, is there still a deep need for evidence-informed policy processes and frameworks? Is that missing?
I think the evidence is quite clear. As stats currently show, there is 4% of our population which is migrants compared to the rest of the country. This is clearly not burdening the healthcare system at all. Where is 4 to 5% compared to the majority? We can also see from stats there is 84% of our population which uses the public health system. And of this 84%, there is only 5% of which are migrants, which is clearly not the reason for burdening. I think there must be, we must interrogate the department, because it is the department's obligation to fulfill the rights of the Constitution. And if the Constitution clearly states that everyone has access to healthcare services, this must be provided to everyone. Healthcare is not a privilege for the few, it is a right for all. And to turn sick people away because they were born elsewhere is to betray the values of our Constitution as well as Ubuntu.
All right, Faatima Laher is a legal researcher at Section 27. As I said, we're going to get to the debate in a short while. We'll bring in the other voices. We have maybe a contrary view, or how we can broaden those, or is the law too broad speaking, and what are the implications on the ground? Faatima, thank you very much indeed. We will speak to you in a short while. Our regular word on the street feature. We took to the very streets of Johannesburg seeking diverse insights and perspectives on this topic, and this is what you had to say.
We're all human, and I feel that everybody has the right to health care. Whether you're a foreign national, you're not from here, fact is you're human, you need that health care for you to live.
So these people, they've caused depreciation in our budget. The health system, the budget is overflowing because of them.
I think it's repugnant. I think it's disgusting to turn anyone away from healthcare that they require. Yes, we have problems in this country, economic problems, but we need to look after people.
If you look at it, illegal foreigners 10 to 1 are not paying tax. And for any government institution to run efficiently, we need taxpayers to contribute to the tax bracket. And by so doing, if they're not contributing, then obviously people that are South Africans in that case will then suffer.
It's a bit tricky because logic will tell you that they need to be in the country in a lawful way, you understand? But also, everyone's got a right to that basic health care.
Yeah, I think the approach is not a good one. Yeah, obviously, when someone needs help, you need to help. But I think this exposes a lot of work that needs to be done from government. I think there has to be some involvement from Home Affairs. I think they need to get their ducks in a row as Home Affairs and ensure that these people are also documented.
All right, we appreciate your thoughts on this matter. Let's get the discussion on the road. It's important for us to understand the realities on the ground as well as get plausible solutions the way forward here in South Africa. A number of guests lined up here tonight. Zandile Dabula, Operation Dudula leader, as well as Ropafadzo Maphosa, law specialist, University of Johannesburg. We also have Bonang Sepoloane, national strategic organizer of the Progressive Forces of South Africa, joining us virtually, and Faatima, as you heard her before, legal researcher at Section 27, our digital audience as well. Freeman Bengo, I understand that you wanted to get into the conversation very quickly. Let's get your take. Let's get your take. What issues did you have with what Faatima was saying?
You know, honestly speaking, I'm grateful that I see my president on the panel. I won't talk too much, but the issue of Faatima using the constitution against South Africans is pathetic. You know, it's this very same constitution which got us to this problem. So Faatima, you need to relax. Eventually, someday, the constitution will be changed to favor South Africans, not foreigners. That's all I wanted to say. And I'm not going to talk too much today, but I want to say, as like your producers said to me, what else can Operation Dudula do? I'm saying Operation Dudula will go to the health system, education, SASA, all sectors which are infested by illegal foreigners. That's all I'm going to say from now up until the end of this conversation, because I see my president is there. Thank you very much. Thanks,
Freeman. Faatima, I'll come back to you in a short while, but I want to bring in Zandile into the conversation with regards to maybe taking what Freeman has to say. Is that what Operation Dudula is calling for, a change in the Constitution? Because the Constitution is clear in terms of Section 27. Is that what you're calling for?
So yes, that is, Freeman is definitely correct. So remember, when a Constitution is done, it needs to cater for the people in that specific country. Nobody does a Constitution for the whole world or that accommodates people in the neighboring countries. Now, people are misinterpreting, especially the preamble that says South Africa belongs to all who lives in it. Now that means, remember in the apartheid days, other people were excluded. Your blacks, colored, Indians, we were excluded. Now that preamble talks to that everyone, now meaning that diversity. Now people are misinterpreting that. Now, when we talk about healthcare systems, Faatima is telling us that everyone has the right to healthcare. That's correct. But that's Section 22 of the Constitution. That all is still for South Africans. Now that's where, somewhere it says documented and undocumented. Remember, we have South Africans who are undocumented because some of them were born at homes and they couldn't be registered. So they don't have identity. So it also spoke to that. It's not that it's the inclusion of foreigners, but yes, there are immigration laws. Now, Section 17 of the immigration laws, now because we're talking about the medical facilities issue, Section 17 states that when you are a migrant going to somebody else's country, especially in South Africa, you need to have a medical certificate. So this means you will have a medical insurance. Yeah. You will not rely on public facilities because, remember, public facility, there's a budget. Yeah. Now, here we're talking about people who are in the country illegal. How are we going to count how many people we have who are in this country illegally, because we can't count? Now you have a budget that caters for 56, I'm going to make an example, 56 million people. That's your budget for the health department. You need to cater for 56 million people. Now you have double the number. How are you going to cater for double the number when you budgeted for 56 people? That's where the problem is. Right. That's why our healthcare facilities are not coping, because the system is just messed up.
Before we move on, I want to get to a point where we understand if there is technical evidence to support the issue of undocumented migrants having that impact, as you mentioned it. But let me bring you in, Ropafadzo. Is there a misunderstanding, as Zandile is saying, of the law, of the Constitution?
I have to disagree on that. And the reason why is because this is actually a matter that has come before our court several times. And every time when the court has had to interpret Section 27, it has been to clarify that Section 27, the word everyone, includes every single person in the country, not simply South Africans. So on that basis, I would have to disagree with Zandile unless she's saying even the courts are misinterpreting the Constitution. And this is to include even the Constitutional Court, which is the highest court in the land. I must also add that the Constitution must be read holistically, which means even Section 9, which prohibits unfair discrimination, it should be used to interpret Section 27. And Section 9 is very clear about the grounds on which we must not discriminate. This also includes the ground of nationality within the Constitution. So on that basis, I would say it is actually Operation Dudula who are misinterpreting the way that Section 27 must be read. And also to add, she also indicated that one of the reasons why Section 27 was crafted in the way it was crafted was to ensure that even persons who don't have identity documents are included within that provision. So then how is Operation Dudula enforcing their mandate when they approach clinics and they ask for identity documents? Are they not going to also inadvertently affect South Africans who don't have ID documents on them?
I think we're not at the point of identities because remember, no country allows lawlessness. Now here we're talking about people who are illegal in the country. Those people are already criminals. They're supposed to be held and arrested, sent back home. But because we have in this country, we are not led, and laws are just not enforced. That's the same reason why those people are not deported.
If I could respond to that particular part.
Let her complete your point. Zandile, complete
I want to make an example of what transpired in one of the hospitals. Now somebody came, because now the law enforcers don't want to enforce the laws. Somebody came undocumented and it was an emergency. And we said, you know what, life comes first. That's what we've always said, life comes first. But once you have been treated, because it was an emergency and you are stable, we hand you over to the law enforcers so that they can take you back home. Nobody wants to have a lawless country, but we are seeing it here in this country. Now, we can't say that the Constitution has a reservation for people who came in this country legal. No. The Constitution talks about people who came here legally. That's the same reason why it will say no one should be denied medical attention, whether you're a migrant or not. But when you're a migrant, you need to come to the country with proper documents. If you're here to work, you need to have your work permit. That will come together with your medical insurance. But it doesn't say that even if you are illegal, we must still treat you. Yes, we will treat you because, wow, we're the greatest people in the world. We cater for everyone, but there's limits because there's also a budget that needs to be, we also need to think about the budget and our tax money is strained.
Respond?
Yes, so in response to that, so I'm glad you brought up the fact that the Constitution actually specifies that no one should be denied emergency care. And I actually recently read a report by the Daily Maverick which stated that Operation Dudula actually stopped a refugee who did emergency care at the clinic in Hebrew. That woman was not allowed by Operation Dudula to enter into the clinic and receive the help.
You cannot.
Freeman, just 1 second. Let her complete a point.
So that's one point, right? Secondly, she keeps bringing up the budget, right? And yet we have seen in recent years that specifically the Gauteng department always underspends its budget. Just the 22-23 year, the department had an underspending budget. They had an underspending of 1.6 billion. That was money that was allocated to the department, and yet it was not spent, right? So what I think is the issue here, and that is something that maybe Operation Dudula should also be emphasizing, is the issue of corruption, undermanagement, poor infrastructure, corruption as well within the department itself. Why is the department talking about lack of resources and yet not spending its budget allocation annually?
Right. Freeman, do you want to come in?
You know, the lady speaks about Daily Maverick. The only organization means one of the media organizations which are against Operation Dudula or against South Africans. So she's not giving us something credible. You know, what the president is saying is simple. Let's prioritize South Africans. It's simple as that. Right. This is my last comment.
Let's. I see hands up already. Kustas and Tabang. Kustas, to you first.
Right. Thank you very much, Blaine. I'm concerned how this conversation is going. Because people are selective in terms of interpreting the constitution. Healthcare in South Africa is governed by the Constitution, National Health Act, and the Refugees Act. And then there's the Immigration Act. Now, all these laws must work harmoniously. And the Immigration Act states that very clear that the staff at the clinics and hospitals must find out the legal status of the patient before providing care, except in emergency, this is only. It further continues that hospitals and clinics shall report to the Director General any illegal foreigner or anyone whose status is not clear. So when the guests are talking about this constitution, they must understand that there's also the part of the Immigration Act. So I'm suggesting to you, Blaine, that when people say everyone is just welcomed, that constitution does not promote lawlessness. So what they're doing is they're abusing that constitution to promote lawlessness.
Right.
You see, so I'm suggesting to you that the Immigration Act is at odds with the Constitution, National Health Act, and the Refugees Act.
Because I hear your point.
And I think that the white paper was supposed to come in and resolve this matter. So when your guests start to talk, they might just don't pick one side of the Constitution. One must take the Immigration Act into consideration, National Health Act, Refugees Act, and the Constitution. Guess what you will find out when I explain? You will find out that very clearly, people that are illegal in the country are not supposed to be covered by the Constitution, because that Constitution would not promote lawlessness.
Right.
So why is it that the hospital people are not being checked their status? Because that is in the law.
Appreciate your point. Thabang, let me hear from you.
Good evening, Blaine, and your viewers. So it is a double-edged sword, right? So on the one hand, you have, the courts, even including the Constitutional Court, and the Kosa case saying, the word everyone is not limited only to citizens. And, in other case law, even in the Supreme Court, saying, human dignity knows no nationality. But on the other hand as well, you have, other case law saying that, the provision of healthcare is subject to available resources. So when, the provision of resources now, the South Africans get the short end of the stick, and it brings about, an aggressive retaliation from, organizations like Operation Dudula. But however, under these circumstances is that where do we balance rights, whereby, and who is afforded an opportunity first? I think that's where the issue is at this current moment.
Faatima, let me bring you in here to find out, in terms of research, is there any evidence whether or not undocumented foreign nationals' utilization of the public health facilities in South Africa is the cause of the difficulties that we are currently experiencing?
No, definitely not, Blaine. And as I've mentioned earlier, the percentage of migrants in this country is 5% compared to 84% of people who use the public health system. And as our previous speaker said, that the Constitution is subject to progressive realization, specifically Section 27 of the Constitution. It further goes on to state that the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of these rights. And this does not mean we must discriminate against the 5%. This means that the state is responsible for ensuring that resources are provided for all who live in this country. And I think it's very evident, especially as our panelists said earlier, underspending is a huge issue that we are seeing across departments, specifically in the Department of Health. Sure. We had a case in the High Court recently where we took the Gauteng Department of Health, where we represented Cancer Alliance. And this was a case where people weren't accessing radiation treatment for cancer. And one of the issues in this case was there was 250 million rand that was underspent by the department. It was ring-fenced funding for these cancer patients. And the department said that it has allegedly gone back to Treasury,
right.
And this 250 million cannot be accounted for. But it's things like that.
Just hang on for a minute, 1 second. Yeah.
It's underspending, it's corruption, it's things like the murdering of Babita when corruption is spoken out about. And these are the issues that our healthcare system is facing.
All right, we're going to come back. We need to take a quick break. But could it be a governance issue? What sort of research has been Operation Dudula has done on the ground to inform the actions that you're taking? I see Bonang is also back with us. I want to get her take as well. Quick break, discussion next. Welcome back. You're watching It's Topical. We ask you a question of the week. Look, South Africa is a diverse society, right? So what sort of principles should be guiding healthcare access in this diverse society in South Africa? We'd love to hear your thoughts at SABC News_TV. A number of guests here. I see Bonang is joining us as well. Bonang, your take on the problems that currently facing South Africa's healthcare system, and is it necessarily attributable to undocumented foreign nationals or foreign nationals using the system?
Thank you very much. South African and Panelists. We believe that as progressive forces, we didn't just wake up and decide that we want to engage with the community and people educate. The reason that we the people educated, number one, I would not support. I had Faatima speaking that we keep talking about the open.
Bonang, we're having terrible connection issues. Control, can we try to fix that up? Maybe redial Bonang, bring her back into the conversation. Zandile, let me bring you in and find out about your research that you have done as an organization to inform such actions, because as we said, we tried to reach out to the South African Human Rights Commission. They weren't available to come on. They saying no civic group or individual has the legal authority to control access to public health facilities or to enforce immigration laws. The power to inspect, arrest and detain undocumented persons lies solely with the Department of Home Affairs, supported by the South African Police Service.
So that's all that they can say, because as Human Rights Commission, they're supposed to be catering for all humans. But it looks as if Human Rights Commission is for foreigners, because we only see them when there are issues of immigration. But when there are issues of South Africans, I mean, how many kids have we lost due to poisonous snacks? And we all know that where the kids get the snacks from a shop that are owned by foreigners. How many raped girls do we have that were raped? I mean, we had a case in Krugersdorp where the Zamazamas allegedly raped young girls, and it was an ongoing case. It's just that our law is just slow on some of the things. We don't even get closure to these things. But a Human Rights Commission is not there for South Africans. Now, I keep hearing Faatima talk about 5% of illegal immigrants. How do you count how many undocumented people are there? Because the only way of counting people is when they are documented. I mean, that 5% is just nothing. Now, we have seen on not just social media platforms, but it was all over the news when a bus going to Zimbabwe was stopped and searched, and medication was found in that bus. Not just 2 bottles of syrup and 2 bottles of pills. No, it was medication. Now, this proves that we've been saying that these people collect medication from different clinics. So one person would go around probably 5 healthcare facilities. Yes, that person probably has a chronic disease. Now, they would go to a hospital and hospital collecting medication. They collect everything and then they go and sell them at their countries. It's proven. We've seen it. It's not
if you
something
have evidence
that
of this, have you approached the police?
So we've always done that. I'm sure you know that since 2021, Operation Dudula has been marching to different departments, asking them to intervene in this matter, because immigration issue has been a thorn issue, and not even the president of this country is talking about this issue. So yes, we are the citizens, concerned citizens, and when community invites us, we will definitely respond, because this is our tax money, and we can't just let it be spent on people that are making business because they're selling the medication. They don't need it. They're not sick.
Ropafadzo, what's the risk here for such action?
My concern with the way that Operation Dudula is going about enforcing their mandate of protecting the country against illegal immigrants, as they say, is how they're constantly harassing sick people at hospitals. And the Human Rights Commission is correct in saying that there is no legal authority for a private organization to be impending access to hospitals and clinics. This is the job for immigration officials from the Department of Home Affairs. This is the job of the South African Police Services. So it is correct that there is actually no legal basis for doing this. Now, there is a problem within this country, right, of illegal immigration. No one can deny that. But who are the parties responsible for responding to that? That is the job of the Department of Home Affairs. So what we need to actually establish is on what basis Operation Dudula is going from hospital to hospital and preventing sick people from entering hospitals and clinics to get access.
The problem is that I would agree when we talk about corruption and within the departments. The problem is that we are led by incompetent people. People are just placed in these positions and they don't know what to do in those positions. Now, we have people collecting.
At what level are you talking
from the
about?
highest level. I mean, why is the president not saying anything?
So shouldn't your organization...
Hold on. It's all over social media platforms that we have a crisis, and he's not addressing it. The system are not talking to each other. Now, one patient can go to one clinic, and they will not capture the person to say that so-and-so collected X amount of medication at Hillbrow Clinic. And the next day, that very same person went to the next clinic to collect that very same, because if the system would have talked to each other, even with Home Affairs, we wouldn't have been in this problem, because people are just collecting and collecting, even undocumented. Somebody can just literally have a card, a clinic card. It's your clinic card. I use it to go collect medication. You will not even be able to see that it is not it's not your clinic card, because somebody else.
Have you heard about these allegations?
I have not heard of the specific allegations. What I do know is that our public hospitals are receiving an influx of immigrants. That is not an issue at all. We understand that. My issue is, if
now you sound like that policeman who said he doesn't have a problem with illegal migrants.
It's not that I don't have a problem with illegal migrants. I have a problem with how we handle that situation. Because if we're now denying life-saving healthcare to people, if we are now harassing sick people at hospitals, that is not the way to handle it, not even legally. There are certain organizations, certain departments who are assigned with that duty to do so, right? So if they are acknowledging that this is a systemic issue, why not engage with the relevant departments or relevant stakeholders to handle that?
Let me go to our digital audience, get some questions from there. Let's go to Ruth first, Demakatso, then Hosi. Ruth, to you.
Hi, am I audible?
Yes, loud and clear.
Awesome. I just want to thank all the panelists for their valid points, valid concerns. I think I just want to point out that when we're looking at specific communities in the with illegal immigrants, I think understand that the issue at hand is illegal immigrants. So they are illegal immigrants. Healthcare. So when certain communities are, for example, at Hillbrow, right? Of course, you're going to have a particular demographic, because that particular area is known for having a certain kind of migrants there, right? So when we're reporting on the issue of hospitals being filled up with these quote-unquote illegal migrants, and we are enforcing some kind of mechanism in a particular community.
Oh, the line is just...
the public issue. Sorry?
Your line is terrible. Just make your point very quickly. Let's see if we can get that.
Okay, so the first point I'm making is that demographics play a factor in the particular kind of migrant that you're seeing at a place. So if you go to Hillbrow, of course, you will see certain kind of migrants as opposed to if you would go to Sandton, right? The second thing I want to point out is that reporting to the correct individuals to enforce, for example, checking of IDs is important because they have the mandate to do so. If we allow civilians to just go about and enforce the laws, then now how do we draw the line between we're genuinely concerned or we are harassing people who are sick, as was mentioned by people before, right?
Ruth,
and I think what's important to point out...
I think let's pause it there due to time, but we got your point. Thank you very much indeed. Maphosa, let me hear from you.
Thank you very much, Blaine, and good evening to everyone. I think we possess a multifaceted issue here in South Africa, both within our governance system and enforcing that kind of constitutional structure that we talk about. But not only do we have that, we have an issue of scaling. Right? Faatima was talking earlier on of an approximation number, which must be clear that it's an approximation number because we don't have the correct estimate of the number of illegal immigrants. And I think that's where the large bulk of the problem comes from the contributions made on the floor. But we also need to be very critical of how we approach this issue because, again, we're reading this in a silo. We have an issue here of illegal foreigners within the country, which need to be dealt with as illegal foreigners within the country. And the Constitution recognizing persons within the country needs to be also articulated as such, because it can't recognize a person that is illegal to South Africa, because it hasn't granted you that right. And again, we then have different case laws which will talk different to the issue, which I would assume at this point in time, we then need to have a serious review of that to get it in line, because it's a problem that we're facing and that needs to be addressed. And on the issue of Operation Dudula harassing people in hospitals and so on, I think in terms of Criminal Procedures Act in South Africa, if indeed what they're doing, if the Human Rights Commission recognizes it as harassment, in terms of that act, the Human Rights Commission has the right to open a case to hold them liable for harassing people. But it hasn't done such, which raises a lot of questions as to where do we draw the line? What then is the truth of the law of South Africa? Because if even structures that are meant there to protect citizens are not acting in a timely manner to effectively address this issue, then we're stuck in a point where there's a grey line within our understanding of the Constitution.
We would have loved to have the Department of Health as well here. We did invite them. They weren't available. The South African Human Rights Commission as well. But we hear your point, Maphosa. Thank you very much indeed. Control, please let me know if Bonang returns. I'd like to get her take on this as well. Hosi, let's hear from you.
Good evening. Am I audible?
Loud and clear.
Wonderful. So I think, and I'm going to try and be as short as possible, I think that this is a very, very nuanced argument. And both sides have very, very valid points. But if there's one thing that we need to consider, and I think this is something that we have neglected throughout this entire discussion, is that health is a security issue. And when we look at our policy and with regards to how the state handles health in this country, we recognize the fact that we need to treat citizens of this, we need to treat whoever needs treatment, not only because health is entitled to our citizens, but because it is a health issue. How else are we going to be able to contain certain contagious diseases that may come from other countries, right? Yeah. That is the burden of the health system. The second thing is that it is also a very moral issue. And I think Operation Dudula has raised the argument that they are concerned citizens that are trying to prevent foreigners taking advantage of the health system. But at the end of the day, it is the responsibility of the health system to ensure that whoever is in this country does have their health taken care of. And that is why, for instance, the Immigration Act stipulates very clearly that it is the responsibility of the hospital which is taking care of a foreigner to determine whether they're documented or not. It does not say do not treat the patient. It says report the patient to authorities.
Right.
And I think then the question should then be, or rather the discussion should then evolve to, as citizens of this country, are we going to place the pressure on immigrants and the healthcare system to not treat foreigners? Or are we going to put pressure on the state to strengthen its health system so that it can have the capacity to be able to deal with the citizens and foreigners? So if we look at it from that perspective, I think we can get a lot more results, particularly with the debate that we are having.
Good, Hosi, thank you very much indeed. Kustas and Tabang, I see your hands, but I just want to bring Zandile into the conversation. And what about the issue of, if there is concrete evidence of cross-border flow of patients coming in, why don't we have some multilateral discussions with those countries involved to bill for those patients that are coming and getting services here?
So that's the right question. What is our government doing about it? Because yes, our systems are strained. Not just the medical system, not just the health department, but all of it. Schools, employment. I mean, how many people are unemployed, but yet we have foreigners who are occupying those positions? Now, the first thing is that we have porous borders. We all know that. But what is the Department of Home Affairs doing? They just spent last year 22 million on deporting illegal migrants, but the borders are still open. That's just waste of 52 million. They should have used that money to strengthen security at that border. Now that goes back to incompetent officials that we have in this country. Now, somebody comes to this country illegally and expect us as South Africans to use our tax to cater for them. Now, we're not saying we hate them, but we also hate how they conduct themselves. You can't go into somebody's house and not even knock on the door and expect that you'll be fed. And if they can't pay, if they want to have free medical assistance, then it means we must also buy them food. We must make sure that they have toiletry and all that. It can't just be about health. We understand that health is just a thorn issue, but now, another thing is that you coming to South Africa, you should have a reason why you're here. If you are a visitor, that's fine. You are given 3 months to go back home. But if you're here to work, you'll have your work visa. That will come together with your medical assistant. You will not need a public facility. Now, public facilities are just for citizens of this country. Yes, if there is an emergency, then you can go there definitely. But you will have proper documents to be assisted. Unlike just all of us saying that people are saying we are inhuman because if they want to call us that, I mean, even the president himself called us vigilantes. But if we have to save this country, someone needs to do something about it. It cannot just be business as usual.
You do understand the fact that preventing people from accessing healthcare facilities, I mean, your members are not doctors. I'm not sure if they are. Maybe they are. But if they are not, then they can't make that discretionary call to say, okay, this person looks fine, maybe let's,
Now, we're not talking
them.
about people who are like very sick here. We're talking about people who are collecting chronic medication.
But how do you know that they're collecting chronic medication?
Hold on. That bus on its own will tell you that the people are running business. If somebody is sick, I mean, I'm not saying that you can tell if somebody is bad or not, but when a person is sick, you can tell that, no, that person really needs medical attention. We don't deny those people. They can go inside. But what we will not allow...
You could be missing some symptoms there. I'm just saying there could be other issues other than face value.
I hear you. But that person, what are they doing in the public hospital? They're supposed to be in private because they would have a medical certificate with insurance. Why are they at a public facility? But what are they doing here? Why are we always accommodating people that we don't even know why they're here? You should come here in this country for a reason. If you're here to work, it's a scarce skill. We take you from your country with that skill to come and work here in the country. You will have proper documents. Why are they here? Why are people fighting so hard, so much to be here in this country? We understand it's one of the greatest, but you can't just come here and be roaming around and doing nothing. We can't.
Yes, if I could respond to that. So the right to basic healthcare in the Constitution is not a qualified right. It doesn't say the right to healthcare is for residents who are here to work or is for residents who are here to study. It's an unqualified right. If you read it in the Constitution, that is one thing that every court can agree on, that this right is unqualified. The only part where it's qualified is in terms of resources and how the government is to realize the right to healthcare. But in terms of who actually qualifies for it, there is no qualification. So this, or while there is a concern for illegal immigrants, I think it's very difficult how Operation Dudula is navigating this. It's like you said, how are they assessing patients at hospitals and saying, okay, you are worthy of healthcare and you are not? They are not doctors.
Let me go to our digital audience and see hands up. Kustas, let's hear from you, Thabang, and I see we're joined by Vusumuzi Sibanda as well. Kustas?
Yeah, my final parting shot in this conversation when I blame is that I really sympathize with South African citizens who go to public health and not get the assistance because it probably will not be full. But I call on Home Affairs. Why is it that Home Affairs doesn't have immigration officials at health care facilities? The Immigration Act mandates the health staff to check the status of a patient before providing health care. So if Home Affairs can take immigration officers stationed in each and every clinic, we would stop this nonsense of people just going there and then without papers. Because you give them healthcare and then you deport them immediately. So
maybe that's a conversation that we need to bring in Home Affairs and to check some of the numbers as well that Zandile has mentioned as well. I hear you, Kustas. Thabang, just pause it, Thabang. I'm told that Bonang is joining us via the telephone. Bonang, are you there?
I am here.
All right, we can hear you loud and clear. Just give us your thoughts. We're running fast out of time, but I'm glad we got you at the tail end.
Yes, firstly, I would like to greet South Africa, and then first instance that I wanted to rectify is Faatima keeps on saying 4% of the population which are foreigners, of which the 4% that she's referring to are the people, they are the foreigners that are currently in our population of existence, not the undocumented people. In 2022, lawyers for human rights went to Parliament and presented to Parliament that there are over 50 million undocumented people within the Republic of South Africa. So she is being indigenous when she says to us that it's only 4%, so it doesn't matter. We can say that it matters. Given the initiative that we started, we see the difference is very huge. So she cannot come to us now and tell us that what we are doing it doesn't matter. The other, they keep on talking about the Section 47, 1 and 2. You know, the Section 2 says, given that they are limited resources, we do have to take our grandparents to the clinic at 4 a.m. and at 4 p.m. It is the right.
Bonang, I'm just told by control as well that we are battling to hear you. We do apologize. It's probably the network issue because we tried both now on virtual as well as the line. But I think we got the first part of your comments. I just want to bring in, before we run out of time, Vusumuzi, let me hear your thoughts before we go back to Thabang. If you can unmute Vusumuzi. Let's try that again.
Okay, thank you very much.
Yeah.
Yes. Look, I think what we're dealing with here, for example, I was listening at what Zandi was saying, that people are coming in and, you know, they're accessing, they're free, we're doing this and that. South Africa, I mean, like any other country, I think it's a country where there are laws. What Zandi and, you know, her friends are doing is besides the law. It is not provided for in the Constitution, period. It doesn't matter how somebody, you know, makes themselves eloquent or try to make themselves relevant in trying to advance something that is not provided for. Politically, if somebody does not agree with the laws, you actually campaign to be voted for and change the laws rather than to act outside the laws, because you're saying that the people that you claim are irregular or have come into the country illegally, and then you go on to act in a manner that is illegal. I mean, it's one and the same thing. So the behavior is just, you know, basically, you know, I mean, it's the same, except that in this particular instance, one is directly violating quite a number of rights that are within, you know, the Constitution. Right. So it should be an issue of saying, if one has a view, rather get involved in some civic education to conscientize people about your views so that you get a buy-in rather than to act in a manner that is unlawful and in a manner that is not, you know, it's not advanced or informed by any, you know, factual or legal basis. but just the whimsical thinking of somebody that has got these populist ideas that want to bring people at a confrontational level.
All right. Vusimuzi, thank you. Tabang, I was going to come to you, but I have to I've got about 30 seconds or so to wrap up the show. Zandile, I have to get you to respond to that.
So Vusi can call us populist, but the rest of South Africans are complaining. So it means all of South Africans are populist. And I'm going to assure Vusimuzi that we're not going to stop. What we're going to do is going to intensify this. We're going to look into doctors that are non-South Africans, whether they're documented or not, because we have unemployed doctors who are sitting at home whilst we have doctors working in those hospitals. So
how are you going to do that?
Stop.
Are you going to physically go to the hospital?
We're going to go to the hospital like we're doing. We're going to go to the hospital and check how many foreign
at the risk
national
of being arrested.
Doctors do we have in that facility, and we'll have to replace them with South Africans. So we'll literally have CVs of doctors, and they will have to admit them, because we cannot carry on like this. I mean, we're a country with laws, and the scarce skill list, we have that. Why is it not being followed? Why do we still have so many foreigners as doctors in these facilities? Unfortunately, we're not stopping, but it's going to intensify. We're going to continue.
And look, we'll continue to cover the story as well. We're fast running out of time, but thank you very much indeed, Zandile.
It's a pleasure. Thank you for having us.
Also, Ropafadzo as well, our guest, Faatima Laher. Thank you so much indeed. And Bonang, unfortunately, we couldn't hear. A digital audience, value added, no doubt. Conversation, no doubt, continues. Thank you so much indeed. All right, before we go, here's my take. Look, in situations like this, I always try to ask myself, is it fact or feel? Feel tends to refer to a subjective emotional experience based on or influenced by personal opinion. And make no mistake about it, that's fine. That's not a bad thing. But I think being able to distinguish between the two will give us a clearer eyes for solutions. I heard Wits School of Governance professor Alex van den Heever saying that we should be setting up a multilateral agreement on how to deal with the funding of unavoidable cross-border flows, whereby countries share in the paying of public health services. And this must be done on a basis that is audited and accounted for. Could this be the route to take? Could this be part of the solution? Let's continue to look for avenues of opportunity to put paid to the problems that we are experiencing at healthcare facilities here in South Africa. And again, I say, let's try to make conversation part of the cure. And that's my take. If you miss anything on this program, be sure to watch this episode of It's Topical on YouTube as well as SABC+. If you're watching a repeat of this program, then as always, the news continues. Unwrap Africa up next with Tembekile. Until next week, my brothers and sisters, take care. Bye-bye.